The Centers for Disease Control estimate that more than 1 million people in the United States are living with HIV. The Metropolitan Interdenominational Church Technical Assistance Network has responded to a rise in HIV among African Americans by focusing on Black churches and faith leaders. Let's welcome Ulysses W. Burley III, a member of St. Stephen's Lutheran Church and clinical research fellow at Northwestern University's Feinberg School of Medicine. We also welcome Reverend Frederick Shells, Director of HIV/AIDS Awareness and Prevention at City Lights Community Outreach Corporation and Associate Pastor at Pleasant Green Missionary Baptist Church in Chicago. We also welcome Sylvia Jo Oglesby, founder of the Clergy Leadership Summit for HIV and AIDS Community Outreach and founder and director of Inglewood Advocates of Grace for Lives, Education and Service. Welcome to you all. Thank you for being here. Reverend, could you start us off by framing this conversation for us that's happening inside the, in the ministries and the kind of communities of faith inside the African American community?
The issue of HIV and AIDS with reference to the church and the Black church in particular is one that we have kind of had a blind eye towards. The issue of HIV and AIDS with reference to the Black church. There's been no talk from a congregational perspective about HIV and AIDS. Nobody came in and said, hey, we need to do this or we need to do that. It's all been silent. With reference to primarily because of the silence is that it was believed that HIV and AIDS was an issue of the gay homosexual community, first of all, and that it had nothing to do with the church. Well, that has changed. History has changed the course. It is now more of a heterosexual problem and an issue in the community as a whole than it is for the other side of town.
Ms. Oglesby, how have you seen this issue inside of the African American community, more specifically the African American community of faith, change throughout your work and through your work?
Well, actually my work began in the church through the Black Methodist organization many years ago, where a number of our men realized that the church needed to address this issue. And so they applied for a grant from the AIDS Foundation of Chicago. And I ended up as the director of that organization and having the responsibility to make sure that the churches developed programs to address HIV/AIDS. And so that was the beginning. And we had a number of people trained as HIV/AIDS instructors through the Red Cross. And we were able to get at least, I think, 5 or 6 programs established. Those churches are still functioning in their HIV/AIDS ministries. Then we went to a broader perspective by dealing with the community and reaching out into the community and connecting with other organizations that are doing the work. And what we realized is that while the churches are slowly taking up responsibility for addressing HIV/AIDS, much more is being done now than was done before.
How have a younger generation of church leaders addressed this problem, addressed this issue, or changed the conversation or the tone of the conversation in the African American communities of faith?
You know, it's really about bridging the gap. And often in the church there have been installations in place for many years. Things have been done the same way. People have served in their capacities forever. And this issue, more or less, of HIV and AIDS, which is a relatively new issue, was not the issue of the general population of the church 30 years ago when they were young people. And so HIV and AIDS has always been a part of my life, has always been a part of my psyche. And so one of the initiatives that young people need to do is to try to bridge the gap with the more mature, with the more established members in the church, and to let them know that this is not just a young person's issue. This is a human issue.
Right.
This is all of our issues. And so in that effort, we've really been trying to integrate generations and really work together and educate each other on this epidemic that affects all of us.
And when talking about HIV/AIDS, it's a very closely related conversation to talk about how issues of sexual diversity have been addressed or not in African American communities of faith. How has that kind of topic and issue been integrated into the conversation of addressing HIV and AIDS in communities of faith?
It's very difficult in the church because you don't have that conversation. Not in most black churches that I've been to anyway. Not even in my church. We don't speak in terms of MSNs and LGBTs and transgender sexes. We don't. We speak in terms of heterosexual, but certainly the symposiums that we've been attending put on by the Metropolitan Interdenominational Church has, how shall I say, bridged the gap for me anyway, that avenue of conversation. In other words, it's made a way that I could cross over, and now it has sparked my interest in reaching out to MSNs and people of likeness. How is it that you're existing, and where are you worshiping? And I don't care what you do when you're alone and by yourself or with someone else. It's what you do when you're out in the open, and you need the care that I can give spiritually, and that we can provide as a church community. That's what I'm concerned with people. The whosoever compassion and kindness and reaching out to them is what my concern is right now.
Ms. Oglesby, can you kind of talk to a little bit about that whosoever movement and how it's affected your work in the communities of faith?
Well, I am driven. I have no choice. I consider that I'm a nuisance, and I get on everyone's nerves, but I do not stop sending out the message that the truth is that Jesus Christ calls us to be the church to all people. He calls us to love one another. It means that we cannot look at a person's actions. We have to just accept them and love them unequivocally and just do just what he did, because he was the model for us. And that's what we need to do. It doesn't matter how you behave, but we want to help you learn how to behave with less risk involved. And we want to really focus on the bottom line, which is saving lives.
Dr. Burley, how have you and your work kind of brought that message of inclusion and tolerance, and that, hey, there's a healthier way to live your lifestyle in terms of both managing your disease and staying disease-free, whatever your choices you make?
Right. It started for me when I was in college at Morehouse College in Atlanta, Georgia. And at the time, I was the president of the Atlanta University Center Public Health Association. And at the time, Atlanta had one of the highest incidents of HIV and AIDS in the country. And so, of course, that was one of our main goals in order to educate and advocate. And then a few years later, I went on to do a study abroad program in Buenos Aires, Argentina, where I worked with the principal AIDS Foundation there, the Fundación Huésped. And basically, I was in and out of about 4 different public hospitals, and we were seeing HIV patients. It really changed my life. It really changed my perspective. I made friends there. I really was able to connect with their situation and their story, and it really kind of opened up my eyes, so that when I returned here, I kind of had a different focus. And I knew that I really had to minister in terms of whosoever.
Thank you, Ms. Oglesby, Reverend Shells, Dr. Burley, all for being here and sharing your point of view with us.
Thank you.
I'm Bo River. For Different Drummers and the Greater Chicago Broadcast Ministries, keep the faith.